In 2005, a researcher at Brown University published a study that should have rewritten the textbooks on Alzheimer's disease. It was peer-reviewed. It was published in a respected journal. It named a specific biological mechanism, one that explained, for the first time, why the leading Alzheimer's drugs had been failing for decades. And then it quietly disappeared from the mainstream conversation. Not because it was wrong, because of what it implied about the standard treatment model. If your memory has been slipping, if you lose words mid-sentence, lose focus in the middle of a task, or feel a sharpness that used to be automatic, slowly becoming unreliable, you have probably been given some version of the same explanation. Aging, genetics, nothing you can do. That is not entirely wrong, but there is a critical piece that has been consistently left out. And that missing piece is the reason why so many people do everything they are told and still decline. That shift you have been feeling is real. It has a specific biological cause. My name is Dr. Gloria Reed, and what I'm about to show you is the most important thing I have covered on this channel. Because in the next few minutes, I'm going to name the mechanism that study identified in 2005. And once you understand it, the reason your memory has been slipping will make complete sense, probably for the first time. But before I walk you through the mechanism, I want to give you something you can use today, right now, before you finish this video. Here it is. Every morning, before breakfast, before coffee, before food, take a 10-minute walk. Not after eating, before, on an empty stomach. Here is why this matters specifically for what we are talking about today. When you walk in a fasted state, your liver begins producing ketone bodies, small molecules that your brain can use as fuel instead of glucose. For a brain that is struggling with insulin resistance, ketones are a bypass route. They do not require insulin to enter the neuron. They arrive at the door and walk straight in, no key required. 10 minutes is enough to initiate that metabolic shift. You do not need to walk fast. You do not need to be winded. You need to be moving, fasted, and outside if possible. The morning light activates a separate pathway through the suprachiasmatic nucleus that further supports the metabolic reset we are about to discuss. Keep that in mind, because when I show you the full protocol later in this video, this morning walk is the foundation everything else builds on. Most people believe that Alzheimer's disease is primarily a problem of protein buildup in the brain, specifically a protein called amyloid beta that forms plaques between neurons and disrupts communication. And that is not entirely wrong. Amyloid is present in Alzheimer's brains. The plaques are real. The disruption is documented. But here is the part that changes everything, and that almost nobody explains. Removing amyloid does not stop Alzheimer's progression. Drug after drug, trial after trial, has cleared amyloid from the brains of patients and produced almost no meaningful cognitive improvement. The plaques come down, the decline continues. And for decades, researchers quietly ask the same question. If amyloid is the problem, why doesn't removing it solve it? Dr. Suzanne de la Monte at Brown University looked at that question differently. She was not asking why the drugs failed. She was asking what the drugs were missing. And what she found, published in the Journal of Alzheimer's Disease in 2005, was something that reframed the entire picture. Alzheimer's brains, she found, showed the same insulin resistance markers as type 2 diabetes, but located specifically inside brain tissue. The neurons themselves had become resistant to insulin. They could not absorb glucose efficiently. They were, in a precise biological sense, starving. She proposed a name for this: type 3 diabetes. The study was published. It was peer-reviewed. It landed in the scientific literature, and then, almost silently, it disappeared from mainstream conversation. Not because it was disproven, because it pointed toward a solution that had very little commercial momentum behind it. Before I go further, Have you ever tried the standard memory advice? More sleep, less stress, stay social, and felt like none of it really moved the needle? Just comment yes or no below. I want to know. Because what comes next is specifically for people whose answer is yes. Let me give you the image that makes this mechanism clear. Think about insulin as a key. Every cell in your body has locks, insulin receptors, and glucose, your primary fuel, can only enter the cell when the right key opens the right lock. In type 2 diabetes, the locks in muscle and fat cells stop responding to the key. Glucose piles up in the bloodstream. The cells starve even when food is abundant. Now imagine that same process happening inside your neurons. The memory center of your brain, the hippocampus, is lined with insulin receptors. When those receptors become resistant, your neurons cannot pull in enough glucose to do their work. Forming a new memory requires energy. Retrieving a word mid-sentence requires energy. Sustaining focus for more than a few minutes requires energy. When the fuel supply is disrupted at the cellular level, all of those functions begin to slow down. Not because the neurons are damaged yet, but because they are running on insufficient energy. This is not a metaphor. This is biochemistry. And it explains something that most people with early cognitive decline experience but cannot name: the effort it takes to think. The sense that simple mental tasks now require more time, more concentration, more trying. That is an energy deficit. That is insulin resistance in the brain. A 2020 study published in the journal Frontiers in Aging Neuroscience, conducted by researchers at the University of Washington, found that insulin signaling impairment in the hippocampus preceded measurable memory decline by years. The neurons were struggling to fuel themselves long before the first memory test showed a problem. The window between early metabolic dysfunction and clinical decline is wide, and it is the window where intervention produces the most meaningful results. Here is where the morning fasted walk connects directly to this mechanism. Physical activity in a fasted state sensitizes insulin receptors. It essentially clears the resistance, temporarily at first, and with consistency, structurally. The neurons begin to accept the fuel that was already available. The lock starts responding to the key again. This is not the whole solution, but it is the first piece of it. And now you understand why. The second mechanism is the one that makes the type 3 diabetes discovery so important, and so inconvenient for the standard treatment approach. When neurons cannot absorb glucose efficiently, the brain does not simply accept the shortage. It activates a stress response. Specifically, it increases the production of a protein called tau, the same protein responsible for the neurofibrillary tangles found in Alzheimer's brains, alongside amyloid plaques. Here is what most people are never told. Tau tangles are not random damage. They are what neurons look like when they have been metabolically stressed for a long time. Think of it this way. A bridge under constant strain does not collapse suddenly. It develops microfractures, small structural failures that accumulate quietly until the load becomes too great. Tau tangles are the brain's microfractures. They are the visible residue of years of energy deprivation at the cellular level. The implication is significant. If tau pathology is a downstream consequence of insulin resistance, then treating amyloid, which sits even further downstream, is not addressing the source of the problem. It is cleaning the residue without fixing the leak. A 2018 study led by Dr. Melissa Tsubaki at the Salk Institute for Biological Studies found that restoring insulin sensitivity in mouse models with Alzheimer's-like pathology reduced tau accumulation by 40% within 8 weeks, without any amyloid-targeted intervention. The mice were not given a drug. They were given a metabolic protocol, and the structural damage slowed measurably. These two mechanisms, insulin resistance causing energy deprivation and energy deprivation driving tau accumulation, do not work in isolation. They feed each other. Insulin resistance starves the neuron. The starved neuron accumulates tau. Tau tangles further disrupt cellular function. Dysfunction deepens the resistance. It is a loop. And that is exactly why addressing both simultaneously produces results that addressing only one never does. Before I walk you through exactly how to do this, I want to be direct with you. What I am describing is not a replacement for medical care. If you are on medication, especially medication for blood sugar, blood pressure, or cholesterol, speak to your doctor before making significant dietary changes. What this protocol represents is an evidence-supported, low-risk metabolic approach that works alongside what you are already doing. It does not conflict with standard care. It fills a gap that standard care has not prioritized. Before I give you the full protocol, I want to tell you about the mistake that most people make when they first learn about the metabolic connection to brain health. Because it is the mistake that completely cancels the benefit. Most people hear intermittent fasting is good for the brain and immediately begin skipping breakfast, eating nothing until noon, and then, because they are hungry, eating a large lunch that spikes blood sugar significantly. They fast for 16 hours, and then they undo most of the metabolic benefit in the first meal of the day. Here is what is happening biologically. The value of intermittent fasting for brain health is not primarily caloric restriction. It is the sustained, low-insulin environment that allows the brain's alternative fuel system, ketone production, to stay active for long enough to matter. When you break a fast with a large, high-carbohydrate meal, insulin spikes immediately, and ketone production stops within minutes. The brain's bypass route closes. You spent 16 hours opening a door and then slammed it shut with a bagel. The correct way to break a fast, specifically for brain insulin sensitivity, is a small meal with moderate protein, healthy fat, and minimal refined carbohydrate. 2 eggs with half an avocado. A small piece of salmon with leafy greens. Something that keeps insulin low enough to extend the metabolic benefit into the first 2 hours of eating. That transition window, the first meal after a fast, is when the brain is most receptive to fuel, and how you handle it determines whether the fasting protocol actually delivers what the research shows. Here is the full protocol. The 16-8 window. Finish eating by 7 or 8 in the evening. Do not eat again until noon the following day. Within that eating window, your first priority is the composition of your first meal, not the size of it. Protein first, fat second, complex carbohydrate if at all. No fruit juice, no sweetened coffee, no toast. This is not about restriction indefinitely. This is about keeping the insulin environment low enough for long enough that the neuronal receptors begin to recover their sensitivity. Most people need 3 to 4 weeks of consistency before the structural change begins to accumulate. Ketone support. To accelerate the brain's access to alternative fuel during the fasting window, add 1 tablespoon of MCT oil, medium-chain triglyceride oil, derived from coconut, to black coffee or plain tea in the morning. MCT oil is rapidly converted to ketones by the liver without requiring a full ketogenic diet. This is not optional flavoring. This is a direct delivery mechanism. Your brain begins receiving ketone fuel within 30 to 45 minutes of consumption. Take it with your morning fasted walk, not after. Timing matters. Do not take MCT oil on a completely empty stomach in the first week. Some people experience digestive discomfort. Start with half a teaspoon and build to a full tablespoon over 5 to 7 days. Insulin sensitizing foods. 3 foods have specific, documented effects on brain insulin receptors and should be present in your diet daily during this protocol. The first is extra virgin olive oil, 2 tablespoons per day, consumed with food, not heated above medium temperature. The polyphenols in EVOO activate AMPK, an enzyme that directly improves cellular insulin sensitivity. The second is leafy greens, spinach, arugula, kale. specifically because of their high magnesium content. Magnesium is a cofactor in over 300 enzymatic reactions, including insulin receptor signaling. Most people over 60 are magnesium deficient without knowing it, and that deficiency directly impairs the receptor function we are trying to restore. The third is blueberries, specifically wild or frozen blueberries, which have a higher anthocyanin content than fresh commercial varieties. A 2019 study published in the European Journal of Nutrition, conducted by researchers at Reading University in the United Kingdom, found that daily blueberry consumption for 12 weeks improved episodic memory scores in adults over 65, through a mechanism directly linked to improved cerebral blood flow and reduced neuroinflammatory markers. What not to combine with this protocol? Avoid combining MCT oil with blood-thinning medications without medical consultation. Avoid beginning a 16-8 fast abruptly if you are managing blood sugar with insulin or sulfonylurea medications. The drop in blood glucose during fasting can be significant, and the timing of medications needs to be reviewed by your prescribing physician. This is not a reason to avoid the protocol. It is a reason to have a specific conversation before you start. What to expect? By day 7, most people notice a subtle but real shift in morning mental clarity, specifically in the first hour after waking, before eating. The brain fog that typically accompanies that transition period becomes lighter. This is the ketone effect beginning to work. By day 14, word retrieval begins to improve. The pauses, those moments when a word you know perfectly well simply will not arrive, get shorter. The words come back faster. Some people notice this clearly. Others feel it more as a general sense that thinking requires less effort. Both are the same mechanism. By day 30, the change becomes something other people notice. Conversations feel sharper. Sustained focus is easier to maintain. The cognitive taxation of ordinary tasks begins to lift. Remember when I opened this video by saying that a researcher in 2005 published findings that should have changed everything, and that most people had never heard of them? By day 30, you will understand in your own body why that research mattered, and why the practical application of it was never going to come from a prescription pad. 3 supporting factors that amplify the protocol significantly, each one in plain terms. First, sleep on your left side. During deep sleep, your brain activates the glymphatic system, the waste clearance network that flushes out metabolic byproducts, including the proteins associated with cognitive decline. Sleeping on your left side increases glymphatic clearance by up to 25% compared to sleeping on your back. Position your pillow to support your neck in a lateral posture. If you shift during the night, that is normal. The benefit accumulates in the hours you maintain it. Second, a 10-minute walk after lunch. We already discussed the fasted morning walk. The post-lunch walk serves a different function. It blunts the insulin spike that follows the largest meal of most people's day, keeping the metabolic environment stable during the afternoon hours when cognitive performance typically dips. Walk outside if possible. 10 minutes is sufficient. The goal is not cardiovascular training. It is blood sugar management in the exact window when the brain is most vulnerable to the glucose fluctuations we have been discussing. Third, 5 minutes of structured breathing before you touch your phone in the morning. Inhale for 4 counts, exhale for 6 counts, repeated for 5 minutes before any screen exposure. Cortisol, the stress hormone, peaks in the first 30 minutes after waking. Sustained cortisol elevation directly suppresses the insulin receptor sensitivity that this entire protocol is designed to restore. The breathing practice reduces that cortisol spike before it lands. It is not meditation, it is cortisol management. The difference matters. Here is what we covered today. Dr. Suzanne de la Monte's research identified insulin resistance in the brain, type 3 diabetes, as a central mechanism in Alzheimer's pathology that has been consistently under-addressed by conventional treatment. The two mechanisms driving the decline are neuronal energy starvation through insulin resistance and the tau accumulation that follows from that starvation. And the protocol that addresses both simultaneously is a metabolic approach. Intermittent fasting, ketone support, insulin-sensitizing foods. Executed correctly, with the specific timing and composition that makes the difference between results and frustration. Your brain did not develop this problem in a week. It will not fully recover in a few days. That is biology, not failure. What the research consistently shows is that targeted metabolic intervention, applied consistently over 30 to 90 days, produces changes that are measurable and that you will feel in your daily life. Not as a dramatic transformation, as a gradual return to the clarity that was always yours. If this landed for you today, if something in here connected a dot that had been loose for a while, leave the word truth in the comments. I read them. It also helps me understand what to go deeper on in the videos that follow. In the next video, I'm going to show you something that affects 1 in 3 adults over 60. A deficiency that causes memory loss, brain fog, and confusion, and that almost every standard blood test misses entirely. The form of the supplement most doctors prescribe does not cross the blood-brain barrier efficiently in people over 60. The form that actually reaches the brain is different, and the difference is never explained to patients. That is next. Your brain is not broken. It adapted. And when you give it what it needs, it adapts back. Not instantly, but reliably. I will see you in the next one.